Okay guys, time for us to hit the next section in the lab. This is going to be lab 8. We're going to divide it into 2 parts. These are fairly long PowerPoints. It's just can't be helped. We're going to be talking in this one about the axial skeleton, which as you recall is the skull, the vertebrae, and the rib cage. And that's about it. Okay, make sure I've got a drawing tool that I can use, and it looks like I do. So the cranium, the skull, this part right here is going to be the cranium. Oh, excuse me. Inside the skull we have these fossa. Fossa is just another name for scooped out place, a hole, and we have this so that the brain will have some place to sit. Brain is kind of shaped like that, so the skull is going to have fossa. As a matter of fact, they got 3. They got one here, and one here. We'll get to that in just a minute. Anyway, cranium, skull, that's the first thing on your axial skeleton. And we'll just keep on going, guys. Okay. As far as the skull, these are going to show us the facial bones, so I'm going to jump over here to where the facial bones are. Okay, if you look in here, if you look inside the nose, you'll see a pair of these here and a pair here. Now this guy and this guy are entirely separate bones. Okay, these guys are called the inferior nasal conchae. These guys up here, let's see if I can find it on your list. Oh well. Let's see. Yeah, they're over here where the ethmoid bone is. These guys are called the middle nasal conchae. See what else we've got here that we can go ahead while we're here. Excuse me. Want to make sure that I really don't hit anything but what's on your list, because I know you guys don't have like super large amounts of time to be taking sightseeing tours without anything. Okay. This little area right there, you can see it on the skull. That's the lacrimal bone. We call it the lacrimal bone. That's where the drainage is for the tears that run across our eyes all day long. Let's see. Looking for, trying to find where they've got this at. Oh well, we'll do this one now. This guy right here, your upper, is called the maxilla. Can't see the processes yet, so we'll just call it the maxilla. The other parts of it I'll show you when we get to it. This part down here is called the mandible, and I'm not sure where that is on our list. I'm having to look for all this stuff because they've got it scattered. Let's see. Sorry guys, I didn't organize this thing. So, oh, there it is, way over there. Okay, we got the mandible, and oh, there it is. This guy right here, this one that I showed you right here. So let me show you what this is like. This bone is in the middle of the nasal cavity, and then you have an entirely separate bone that comes up here. So this guy is angled, and he is called the vomer. He is definitely on your list. And the other one is called the perpendicular plate. And I'm thinking it should be under the heading of ethmoid bone. So, yeah, sure it is. They've also got superior nasal concha on there, but we'll see if we can find those. We may have to wind up scratching it off if we don't have anything on it. Okay, I think we finally, let's see. I don't want to come back, guys. I just want to make sure we get everything that we can here. Okay, there's a couple of holes here around the chin. These guys are called mental foramen. Those are definitely on your list. And I don't see anything else here. There's a zygomatic bone. It's on your list, but I'd rather show you from a side view because it's a little bit easier to see. There's the nasal bone. Let's see if we've got that anywhere on our list. I do not see it. Oh, there it is, right up above that. Okay, got it. So that nasal bone obviously is just going to be the bony part of the nose. The rest of this, of course, is cartilage. I wonder if we've got superior orbital foramen on your list. We sure do. So, superior orbital foramen, and these guys are the orbital foramen. So this is above the eyes hole, and this is below the eyes hole. A foramen is a tiny hole, guys. So we've got both of those. They've got these broken down by bones, not by location, so that's why we're having to jump from one of these to the other. That surely is all we need. Yeah, they don't have anything on the glabella, so that's not on your list. All right, let's move down. This makes it a little bit easier to see. You can see the zygomatic bone here. In this colored, you can see the lacrimal bone that we talked about. There's the vomer, the inferior and middle nasal concha, the nasal bone, superior, no, that wasn't one of our, that's a different, well, we could do that. So this guy looking into the eye socket, this guy kind of makes a V, and that V is superior orbital fissure and the inferior orbital fissure right there. And we'll contrast that with the foramen. There's the superior and inferior foramen. These guys are the superior orbital fissures. Foramen, fissure. We've got those. Let's see. Optic canal. Let's make sure it's not on there. Well, it is on there. Okay. So this little thing right here just medial to the superior and inferior orbital fissure is going to be the optic canal. That's actually the hole that the optic nerve comes in to attach to the back of the eye. Now this part right here, and we'll see it from the side as well, is going to be the frontal bone. It's basically going to be your forehead, guys, with a little bit extending to the back. The mandible, those are those, they don't show it here, but those are the mental foramen that we talked about. The inferior and superior orbital foramen. Ooh, that's a busy slide right there, guys. Extremely busy. As a matter of fact, I'm not even going to try. You can use this as a reference, but that's just too much information. So here you can see the borders between these bones. So there's our frontal bone that we talked about. Now we can go in and talk about some of these other bones that make up the skull. The skull is not one big bone, unfortunately, but a bunch of bones that are fused together. This one in the back is going to be the occipital bone. We'll see some more on a different view, different things to go there. The parietal bone, there is two of them. There's one on this side and one on the other side of the skull. And that's really all that we need to know on that guy. And this one, let me go ahead, and this one is the temporal bone, your temple. Let's see what we need. This area right here is the external auditory meatus. This is where the nerve comes from the ear to go to the brain to convey sound to be interpreted. The mastoid process is this big triangular shape that sticks down. The styloid process, on the other hand, is this needle-like thing right there. Now, we can see our zygomatic bone a little bit better now from the side. You can also see lacrimal, nasal bone, all that. Now, this is the border between these two guys. So, this is the temporal bone, and this is the zygomatic bone. Let me bring this down here and show you guys something. So if that's the temporal bone, and that's the part that connects to the zygomatic, and there's the zygomatic, and this is the part that connects to the temporal. Listen to what I'm telling you. This guy is called the zygomatic process of the temporal bone. Okay, and I'm guessing you have figured out that I'm going to tell you that this is the temporal process of the zygomatic bone. So in other words, these processes are named by what they connect to. Temporal bone, zygomatic process of the temporal bone. This is the temporal process of the zygomatic bone. Okay, guys? It's one of those things you're going to get used to, I promise. Okay, let's see what else we got here. We need to start talking about some of these sutures. Let's see if there they are. Okay, the coronal suture is going to be this zigzag line where these two bones are fused together. That's called the coronal suture. It's where the parietal bone meets, both parietal bones meet the frontal bone. This is the lambdoid suture back here. It is where the parietal bone meets the occipital bone. This guy right here is the squamous suture. The squamous suture is where the temporal bone meets the parietal bone. There's another one, the sagittal, but it's on top and you can't see it from this viewpoint. And there's the body, the mandible, there's the mental foramen. We might as well go ahead and talk about some of these other parts. Okay, this guy where he turns right here is called the angle of the mandible. That's on your list, guys. This main part of your lower jaw here is called the body of the mandible. This rounded part right here is called the coronoid process. No, I'm sorry. This is the coronoid process. This is the condylar process. Mandibular condyle. The coronoid process. My bad, guys. Sorry about that. And this part that goes straight up is called the ramus. Mandibular ramus. There's only one other thing left on the mandible, and we can't see it from this angle, but I will tell you about it when we get there. Looking at it from the inside, again, I don't want to, this one's got so many little lines, it's very confusing. Use it as a reference, if you will. This one's got just about as many lines, but it is what it is. Let's see if I can see anything in here. Here's something. So there's the maxilla, is what your upper teeth are attached to. This little thing is the roof of your mouth, the bony part. It's called the palatine bone. Okay, you can remember palatine bone. That is easy. And I'm looking to see where it is on your list. It's not out of the question that it got left off. If it did, we're not going to require you to know it, but I want to make sure before I tell you. Well, I don't see it. Maybe it was on there somewhere else. In any case, why am I telling you this? This is the zygomatic bone too. This is the part of the zygomatic bone that connects to the palatine bone. It's actually the majority of the roof of your mouth, and it's going to be called the palatine process of the maxilla. If you look on your lab list under the maxillary bone, let me pull mine up. You see the palatine process. There's also some sinuses in here. These are holes in the skull, air chambers. That's the frontal sinus, and that is definitely on your list. Don't think you can see any of the other. Nope. Oh, there's the sphenoid sinus. Right there. See, that's going to be under sphenoid bone. Sure enough, sphenoid sinus is right there on top of it. Don't think there's a whole lot more we can see in here that's on your list. I don't really like that viewpoint. Now this one's not too busy. So let's look on the bottom. So if you notice, there's a little line there. So that's the palatine bone, and that's the palatine process of the maxilla. See the zygomatic bone, and you can see where the zygomatic joins the temporal. I know the one we saw didn't look quite that defined, but you'll be able to tell because I don't know if you guys can see, there's a little line there where these guys are fused. So this again is the temporal process of the zygomatic, and this is the zygomatic process of temporal. If that sounds like you need to spend a little bit of time on that, then you are absolutely right. You can see the mastoid process and the styloid process. Let's see what we've got under the temporal bone. Jugular foramen we need right there. It's large and it's kind of jagged. Mandibular fossa is right here, guys. That's actually mandibular fossa. It's a bowl-shaped thing where the mandible sits. The condyle of the mandible sits there. So there is our mandibular fossa. Carotid canal. It's going to be above the jugular foramen, and it's going to be smaller and more round. Okay, about the only thing that's left is the internal acoustic meatus. Let me go back here, guys. I might have, there it is. That's what I should have showed you. Do you remember the external acoustic meatus? It's a canal that leads through the thickness of the skull. This is where it comes out at. Okay. So that has got everything on the temporal bone. Okay, this big hole here, this is the occipital bone. That's called the foramen magnum. It's called that because that's the biggest hole in the bottom of your skull, and that's where the spinal cord starts. External occipital protuberance, I don't know if you guys can see, they're right there. It's like a ridge line. Okay. The occipital condyles, they're right there, guys. They're raised up, kind of like that, on the other side of the foramen magnum. Okay, what else do we have on the occipital? Superior and inferior nuchal line. You can see the superior nuchal line there. Oh, there it is. There's the inferior. In between there, in between our occipital protuberance. This is so easy to see. Hopefully I'll be able to show it to you again on the next slide. I want to make sure that we get everything we can. I'm actually thinking that we have on this guy. Let's look at it on one of the colored slide models. This may be a little bit easier. Yeah. So the nuchal lines are here, superior and inferior. The occipital, external occipital protuberance. You can really see the occipital condyles, foramen magnum, carotid canal, jugular foramen. You can see where the palatine process of the maxilla meets the palatine bone. And they're calling that too. Oh well. We'll let them have it their way. Let's see, mandibular fossa, styloid and mastoid process. Let's see what else we have on here. I think that's about it. We've seen everything. This one doesn't obviously have as much as the other. There's the lambdoid suture, and this guy going from the front to the rear is going to be the sagittal suture. You guys know the planes that we've covered a while back. Obviously, these guys fall into place on those. Well, you know, we've got a lot of the skull knocked out, but we still need to look at the inside of the skull. Oh, you can see the protuberance and the nuchal lines there. You can see the condyles. Okay. I'm going to go right straight here. Okay, on the inside, we haven't talked a lot about the sphenoid bone or the ethmoid bone. They're part of it too. We saw the sphenoid sinus and all that. This guy that's kind of shaped like that is called the sella turcica. That means a Turkish saddle. It always helped me to remember that was kind of a saddle. This guy, I've got this real thin blade of bone running like that. That real thin blade of bone is called the crista galli. That means rooster's comb, kind of like that thing the roosters have on their heads. And all these little hold places, those are actually for the nerves coming from your nose. That is called the cribriform plate, and that's what the crista galli kind of sits in the middle of. Let's see what else we got here, guys. There's a jugular foramen from this side, the foramen magnum. There's the internal acoustic meatus. The sphenoid bone. I wonder if they've got a better picture of this. Let's go forward, and if we can't find it, we'll come back. Oh, there's a real good close-up. You can see the optic canal there. You can see the superior and inferior orbital fissures. Infraorbital foramen, they don't really show you can see the lacrimal bone. It's a very tiny bone. There's a good picture of the vomer, that triangular shaped bone at the very bottom. Okay, let's continue onward. We already talked about the internal acoustic meatus. This is a saw through. That's why I was telling you this Turkish saddle. Let's see what else we got. Lateral and medial pterygoids. This is really hard to see on this. Let's see if I've got a better one. No, I don't. Well, at least not yet. But we can do the rest of the sinuses. Frontal sinuses, we did those. We did the sphenoid, so we can see them from both sides. But we can also do the ethmoid air cells, ethmoid sinuses, maxillary sinuses. And that has got all of our sinuses knocked out. Make sure where our thing is so I can put it out. Ethmoid sinus, got it. We've got the maxillary sinus right over there. Let's get that taken care of. We are getting this knocked out pretty good, guys, but I don't want to go there. Okay. All right. So this pinkish thing is the sphenoid bone. This part right here is called the lesser wing of the sphenoid. Make sure it's on there. It sure is. This part here is called the greater wing of the sphenoid. Let's see. Let's go back here and see. If we've got anything in here. Okay. This guy right here next to the sella turcica is going to be the foramen lacerum, and he is on the sphenoid bone. And this guy here next to him is the foramen ovale. He is on the sphenoid bone. I bet you think this foramen spinosum is on the list, and you will be right. There it is. So the three of these guys will be on this slide. The only thing we're lacking is lateral and medial pterygoids. By the way, go ahead and just scratch out the superior nasal concha because we don't have it on our slides. We got everything else, so that was pretty good. Let me look again. I know it's not there, and I know it's not. You can't see the superior concha from the front. You can't even do that in the lab with a model. That is a mess, guys. Oh. And don't think we're going to see it. Here's the pterygoid processes. Those are really hard to see. Oh, here they are. So this one is closer to the midline, or this one is actually, we're looking through the midline. This one would be the medial pterygoid, and that would be the lateral pterygoid. That does have just about everything on our skull list. The skull, guys, is generally the thing that provides the most work for folks that are learning A&P1. So it's just part of it, guys. It's a rite of passage. We all have to do this. All right, so let's pick up. Interesting, you can see the skull of a baby. You can see where the skull is not completely fused together, and that's that fontanelle, that soft spot. And I always hate to see something like that. That's heartbreaking. Oh, wow, they've got it here. So, the nuchal plane, the external protuberance right there, and then our superior and inferior nuchal lines right there. So this one's really good. Frontal bone, we've got everything on the frontal bone. The only thing we had was the actual frontal bone and the actual sinus. Temporal bone, zygomatic is the only thing. External meatus, mastoid, styloid. You're not showing the styloid. It's hidden in. Looks like, oh, sorry guys. Looks like he's under there. Okay. Sphenoid, you can see the greater and the lesser wings with the sphenoid completely separated from the rest of the skull. But we got everything on the sphenoid on the pictures. Oh, you can see the medial and lateral pterygoids. Obviously, the one closest in is the medial. The one furthest out is the lateral. Yeah, the only thing we didn't see was superior concha. I bet we may be able to see this on this guy. There they are. So I guess I better untake it off and put it back on. So I did not know we had one of these. We don't have a lab model like that. But we got a picture and that's all we needed. So there's a lot more bones and parts of bones listed here. Those on your lab list. But focus on the lab list, guys. That's what you're going to be tested on, and that's the most common and most important. Oh, I do owe you the mandibular fossa. That's the only, for Raymond, sorry. And here he is. He's actually on the inside, right there. So that was the last part of the mandible. The only thing I got left on this is, well, the hyoid, and then we go to the vertebrae. But I think we've just about got the skull knocked out. It's a lot to it, I'll grant you. There's that hyoid bone. That's what it looks like in the lab. It's actually a free-floating bone that's right there in your neck. It's an attachment point for a lot of muscles involved in swallowing. Okay, guys, so the skull we've got. Now it's time to do the vertebral column. The vertebral column is your backbone. So these guys, as you can see, are divided into four, well, there are more regions than that. Five total regions. We've got the part that's in the neck. We call that the cervical vertebrae. We got the part that goes through the chest. We call that the thoracic. We have the part that goes down a little bit lower through your abdomen, and that's going to be the lumbar. We've got this part that is actually attached to the hip bones, and that is called the sacrum. And finally, we have this real small section called the coccyx, and that's supposed to be the remnant of the tail in man. These are 5 vertebrae, but they're fused together permanently. The rest of these guys are separate bones, and they got that disc in between them, and that gives you flexibility. So we have 7 vertebral discs. We have 12 thoracic, 5 lumbar. There's 5 sacral, and you generally, I think, 4 coccygeal vertebrae. Now our vertebral column is not straight up and down. It curves. It curves this way and this way, the same way, both in the cervical and the lumbar regions, and it curves outward in the thoracic and in the sacral region. And you can see it right there. The different curves. You do need to know those guys. Again, you can see the same thing. So what are you guys going to need to be able to do? You're going to be able to need to identify which of these. So all you got to do is count. Well, how do I know which is the cervical, which is thoracic, which is the lumbar? Easy. These guys have got ribs attached to them. If they have a rib, it's thoracic. If they are above the vertebrae that have ribs, it's cervical. If they're below the vertebrae that have ribs, it's lumbar. Really, really simple. Yeah, 4 fused in the coccyx. We'll talk about the individual vertebrae. There's parts of that you're going to have to know as well. But I wanted to make sure that we got all the rest of this done. Now, we do have special vertebrae. The first 2 vertebrae, which would be C1 and C2, these guys are so special. Not only that they've got a number, they've got a name. C1 is called the atlas, and he looks like a ring of bone, and that's about it. C2 is a little bit more, but his claim to fame is that he's got this piece right here. It's called the dens. It sticks up. Why is he there? Because that's what this guy turns on. That's why you can shake your head no from side to side, because it pivots on this dens. And there's a ligament, of course, there. So these guys are very special vertebrae. You need to know them by name. The rest of them, it's just use the numbers C3 through C7, T1 through T12, and so forth. Okay, let's keep on going. We've got a lot of slides, but we're getting through them, guys. If it sounds like I've already dumped a lot of information on you, it's because I have. Okay. Looking at our cervical vertebrae, now we can start talking about some of the pieces of this. This is the part that has the disc in between them. Those are just called the body of the vertebrae. Get back over here. Obviously, C1 has no body at all. It's just a ring. So it doesn't really have, it just continues like that. But these guys, all the other vertebrae are going to have these. And they're going to get thicker and wider and all that the further you go down the vertebral column. They have to, because the further you go down, the more weight it's carrying. Okay, out to the side, we've got transverse processes. Usually there's only one transverse process, per side. But this is a little bit different. You also see this hole right there in the middle of this. This is also special. That's called a transverse foramen. The transverse foramen is there to allow an artery to be to go through there. Make sure we find that on here, so I don't leave you guys hanging. Actually, I don't see it. All right then. If it's not on your list, we're not going to worry about it. I don't know why they didn't put it on there. Oh, they did. There it is. I see it. It's under cervical vertebrae. Okay, so that's on your list. Now, those are the transverse foramen. And between the body and this transverse foramen is an area called the pedicle. These are going to be on all the vertebrae, guys. Let's see if I can draw. It's usually going to look something like this. Transverse. And coming off of there is going to be a little piece. And of course, that's where the spinal cord sits. So between the body and the transverse is going to be called the pedicle. Between the transverse and the very back is going to be called the lamina. That's definitely on your list, guys. This thing on the back is going to be called the spinous process. Okay, so this hole right here that the spinal cord sits in is called the vertebral foramina. You need to remember that because there's another thing that's called the intervertebral foramina. And let me show you what happens. I'm going to show you from the side. This guy does this number. The one below him, I know my drawing is atrocious, guys, can't help it. But what happens is these two guys come together and they make a hole right there. That hole is called an intervertebral foramen, not vertebral. Why do you call it intervertebral? Because there's two. It takes two of the vertebrae to make this guy. So I'll show you again on some of the other when we get there. I just wanted to give you the heads up as quickly as I could. Notice these spinous processes change on these guys as you go down. The vertebrae change. They're obviously lighter and on the top and heavier on the bottom. Okay. Spinous process, lamina, pedicle, transverse foramen, transverse process, body, vertebral foramen, superior articular facet. That's what these guys, it's going to attach to the inferior facet on the vertebrae above it. That's what it's there for. There's that U shape that's going to sit on another vertebrae to form the intervertebral foramen. Okay, here's the atlas. As you can see, no body, just a round circle of bone. Has transverse foramen. That's it. You don't need to know any of these extra things. Those aren't on your lab list. Just what's on your lab list. Transverse foramen and the transverse process are on your lab list, but the rest of those aren't. Spinous process. There's the dens. Can't see it that it actually sticks up like this, and the atlas just kind of rotates. So axis C2, atlas C1, pedicle, lamina, all of this. You guys got it. It's just more of the same. Now you can see those intervertebral foramina right there. See how they're made by the coming together of two vertebrae. That's all there is to that. Thoracic vertebrae. These guys are going to look a little bit different. They're going to have longer spinous processes. Some of them are going to be pointed down very sharply too. They're also going to have a special thing called a transverse costal facet. And that is not on your lab list, but that's just the place for one of the two places that the ribs attach to these vertebrae. Same thing, guys. Exactly the same thing. Also, these guys are kind of shaped heart-like. Transverse costal for the rib tubercle. Okay, inferior notch, part of the intervertebral foramen. You guys can look at all of these. There's really nothing new that I'm telling you on this. Lumbar vertebrae, these guys obviously are way thick because they're way down, and their spinous processes are short and stubby like that. Looks like a moose. Well, okay then. I don't know who said that, but they must know. Short, stubby, the inferior notch, everything is exactly the same. Same parts of the vertebrae, guys. You can see the ribs attached to the thoracic. We'll get to that in a second. Sacrum. So it's kind of hard to see, but there's actually 5 vertebrae. This is cut through the middle. I need to see the other side of this, but that's okay. Let's just go with what we got. As soon as I find what we got. Sacrum. Where's the sacrum? Let's see. Vertebral column. Oh, there it is. This part right here on top is called the sacral promontory. That's on your lab list. And if you think these holes right there are called sacral foramina, you're exactly right. Holes through the sacrum. Those are for nerves to leave out. It's kind of hard to see, but there's actually kind of like a area here that it's kind of like that in the back. It's a canal, and that's exactly what it says. The sacral canal. Now, these guys right here, they look really like ears to me, but somebody said they look like wings. So we call those the ala, or ali if you're doing the plural. All right. That. Oh, and there's the coccyx. You don't need to know that or the hiatus, obviously. And we're good on that. Oh, now you can see. See, these are where the vertebrae are fused together into one. 1, 2, 3, 4, 5. See the ala, the anterior part of the foramina, which are just the same. Okay, ribs. Now, they don't have any of the parts of the ribs down here for you, so you don't have any worry about that. We just have to know the ribs as far as there are 12 ribs, obviously, because we have 12 thoracic vertebrae. And by the way, that's how they fit there. See, the head of the rib goes up here, and that tubercle goes onto that piece over there on the transverse process. And that's cool, but we'll stay what we got. Oh, okay, that's where we'll do that. Okay, this is the breastbone. This is what the ribs attach to in the front. We call it the sternum. The sternum has only got a few parts that we need to know. This big chunk right here is called the body, and that's good. This cutout area at the very top is called the jugular notch. This part of it is called the manubrium. And this little part right down here that gets broke whenever we do CPR is called the xiphoid process. That's a name, guys. It surely is. Okay, the ribs. We got 12 of them. I don't know. Let's see if we got a better picture on this one. No, just got the back of it. It's kind of hard to see on here, but let me go ahead. 1, 2, 3, 4, 5, 6, 7. Those are called true ribs. Why are they called true ribs? Well, notice one thing. The rib end's right there, and these guys, the rest of that is costal cartilage. That's all it is. But these first 7 kind of directly attached. Make sure I got that right. 1, 2, 3, 4, 5, 6, 7. Yeah. These first 7 directly attach to the sternum. That's why they're called true ribs. The next 5 are called false ribs because they don't attach to the sternum directly. So number 8, 9, and 10. I'm off one. Oh, I think I 1, 2, 3, 4, 5, 6. Yeah, I did count off. I got off one right there. Okay, so number 8, 9, and 10 here are false ribs because their cartilage doesn't attach to the sternum, it attaches to another piece of cartilage. Okay, those are false ribs. And 11 and 12 are false ribs too because they don't attach directly to the sternum. And 11 and 12 have another name. They're called floating ribs because they don't attach to anything. So that's what we need to know on the ribs, guys. If they might ask you on the exam or quiz to identify it, but again, it's easy. Start at the top. 1, 2, 3, 4, 5, 6, 7. So if they had a thing pointed there, I'd say that that would be the 6th rib. So it's pretty easy. From the back, it's just as easy. Those are the 2 floating ribs. It's kind of harder to see here, but I know these guys are false ribs because the bottom 5 are going to be false ribs. Well, guys, believe it or not, that has got absolutely everything on the axial skeleton. So we're done with this one, and we got another one to go. And I'll see you on that one.